All right. And so welcome again. We love the fact that you guys are here to join us again. And I just wanted to let you guys know that this one is going to be possibly a little bit longer. So if you do need to exit at
Okay.
9 o'clock, that's perfectly fine. Just please, you can always go back onto the WEHA website. So WEHA.net to find all of those recorded webinars. I ask that you please also mute yourself as we are getting a little bit of feedback here. We are hearing some background noise. So please mute yourself so that we can really stay focused on just our presentation today. Also, please make sure to renew your membership if you have not already. And if you're not a member, we would love to have you join. That's a great way to get our monthly newsletters as well as get all of the announcements for all of these webinars too. Next month, we will be talking about rabies quarantine. But right now, I'm going to turn it over to Katie Matulis, who is on the WEHA board, to introduce our speaker.
Hi, everyone. I would like to introduce Mary Ellen Bruesch from DATCAP. She is an environmental health technical specialist specializing in public pools and water attractions. Mary Ellen has worked for DATCAP for almost 14 years. When I asked Mary Ellen what she thought the most challenging part of a pool inspection is, she said it's working with operators to address difficult enforcement or code compliance challenges, such as BGBA, water quality, and lifeguard staffing and shortages. In her free time, Mary Ellen enjoys hiking, paddleboarding, and participating in church activities. So without further ado, I will hand it over to Mary Ellen. Thanks.
Thanks, Katie. Excuse me. So we will get going on the proposed pool code revision. So yeah, like Katie was saying, my favorite part of being an inspector when I was an inspector was working on some of the more challenging and difficult things to help operators to operate safely. So a lot of that is going to be reflected in the pool code revisions that we see before us. So these are the proposed pool code revisions. So we are about a week and a half away from having the approval to be able to move ahead with a new code. So if there are no more obstacles, then we have a 90-day period in which we can get ready for the new code. So possibly July or August. So that will lead me into our first slide, which is we believe that if everything keeps going ahead, we will have a new code in July or August. And today we'll learn a little bit about the background and some of the major changes that are coming and other changes that are proposed. So on SharePoint, and for those of you who don't have SharePoint, my email address will be at the end. So please feel free and to let me know, and I can send you whatever you need. But there's a document that summarizes the proposed changes to happen. So those will be available to you. There are some other key regulations that did not change, and I'll be mentioning those briefly. There's a little bit more information and resources. I'll give you some links that you can go to if you're really curious about the code revision process and things that went on, other documents that we had to submit. And then one important fact is that there are training modules for each area. So please take those. They're going to be, or they are, very short presentations on each area of the code so that you know what changed and what didn't change. And they're made short so that you can do those when you have 10 minutes here or there. So pretty much everyone who's inspected a pool knows that the pool code is older and isn't quite keeping up with the current pool climate. So you might have been involved in variances or confusing definitions. You might have noticed licensing has kind of been an unclear area, because in the olden days we did it one way, and then we changed to doing it a different way around 2010 or 2011, when we realized that a lot of pools had a lot of other items that were in them, or things going on in them, that really constituted a different use of the pool, and meant that it should, we believed then that it should have a different license, because it was a completely different area and different activity of the pool. That, however, is and was confusing. So we're going back to the basin way of licensing in this proposed code. We also have many new technologies, trends in water recreation. We have statistics from our death, illness, injury forms that help us to understand where we might need to adjust the code. We also have our drowning, near drowning, and non-drowning death investigation results that help us to understand where we could possibly make the code stronger. And finally, we're wanting to align our code with other retail and rec codes. So things like active managerial control and criticality, for example, priority, priority foundation, and core. We want to work those into the new code. So this is a list of the major changes, and I'll just go through them quickly, and then we'll look closely at a couple of them. So licensing structure, pools at TRHs and BRBs, action plans. That's one of the areas where we're aligning with other areas of other codes. Interlocks, restricting patrons during maintenance, bromine and cyanuric acid, minimum disinfectant residuals, combined chlorine, certified operators, gates and doors, for example, at lifeguarded pools. Table ATCP 7623, Table B. Those are the lifeguard and attendant staffing plans for pools that have activities going on in them. The length of the shepherd's crook in some pools, cell phones and other similar items. Children under 12, breath holding games, so prolonged breath holding, not that there's anything wrong with holding your breath. In fact, you should when you go underwater, but prolonged breath holding games are becoming or have been a problem, and they've showed up in our statistics in the last year. Signage for whirlpools, waterborne outbreaks, so support for investigating those. Clarification related to files and records retention. Not any longer having a variance for dog swims, and then a special section that clarifies exactly what we want for VGBA records. So in a nutshell, the licensing is going back to, we're proposing that it go back to be by the basin, and then we would give complexity points for the basin, or points for the basin, and determine complexity based on the points. And then if there's one or more features, we would add in a feature fee. This, we believe, is going to promote consistency and transparency, and also reflect the time spent by the sanitarian and also the program as well. And there will be a specific training module on licensing. However, it will be very brief, because we believe the new licensing model is very simple. So this is taken directly from the code. You can see it. The proposed code is saved on SharePoint, or for those of you who don't have it, please feel free to email me. It is 7606 Table A, and it gives the points for each aspect of a pool. So a basin is a point. If the pool is a whirlpool or a therapy pool, we give them a point. And that is because, as we know, whirlpools and therapy pools can take up a lot of our time. If it's not in trying to help operators with their chemistry, it is with the program responding to legionellosis or pseudomonas outbreaks or complaints. And then a point for a recirculation system. If there's a shared recirculation system, as there are a couple out there, it would get half a point. because that takes up a little bit of time as well. If the basin is larger than 1,999 square feet, that's a point. And if it's a water attraction, it also gets a point. So it ends up being in our chart. This is also explained verbally in the code. 0 to 2 points is just a plain smaller, less than 1,999 square foot hole in the ground that's kidney shaped, square, or whatever, but it doesn't have anything else in it. Moderate is going to be whirlpool. So when a pool is a whirlpool, it automatically has at least 2 points. So that puts it into the moderate category, because as we've discussed, they tend to take up a little bit more of our time. And then complex is something larger, generally a water attraction basin. We define feature in the code, and we've also added in that a feature is a depth greater than 16 feet, an area greater than 20,000 square feet, and then also physical items such as pad walk, rock wall, slide, spray, or others. So in going back and forth trying to sort this all out, Jim and I worked with several different models, and this was the model that we came up with, that we were able to assign the pools to a complexity that was a simple system. And then we were able to account for time spent under the feature fees. So we think that is going to be a good model. We've taken pools at tourist rooming houses and bed and breakfasts out of the proposed ATCP 76. So they are no longer required to have a license. If they have recirculating systems, they are not going to be considered public pools. We've put action plans specifically, language about that specifically into the code. So when there are barriers to compliance in a timely manner, just so we may have encountered these in food retail or in campgrounds, for example, with RVs that are too close together. And what it does is it lays out a process for the operator and sanitarian to describe the violation and outline steps towards correcting it, and then have it agree on a timeline for that. So there are some license actions that go along with that. For example, a conditional license. And then if the objectives are not met, the license could be voided. So that language is all in the code. As you know, we've been moving away from, or we have moved away from, testing the interlock when we are on site. We are requiring the operator to be able to describe that process to us. So that is now in the proposed code. So we were concerned about actually facilitating a chemical release. So our background is not in plumbing or electrical. So if we go to a pool and we test the interlock, we're assuming that it's going to work. But what if it doesn't? What if we have them turn off the pump, the recirculation pump, and the chemical feed keeps going? Then we're stuck with, hopefully we can unplug it or something, but we've just created a chemical release potentially. So we want to get away from that. And we want to get away from trying to help people solve problems that are plumbing problems and electrical problems directly. They should really be working with the contractor for that, or with DSPS if they have an architect or an engineer. So that is not something we can directly help them with. So it's something that we are asking them to work with the contractor to make sure they're testing their interlock monthly, and to make sure that they're taking appropriate safety precautions when they're testing it. So they should be making sure that there's nobody in the pool. And if there are problems, they should be working with their pool company to correct it. There's been a little bit of confusion about who needs to be able to explain this to the sanitarian. So whoever is doing this testing should be able to explain it to the sanitarian. We don't need every single person at the facility to know this, just the person who's actually doing the testing. And it's the same, pretty much the same language as what we've got in the chemical safety policy. And there will be also a training module offered for this, for the new code. We've emphasized in the new code, the proposed new code, restricting patrons during maintenance. So we want to make sure that if they're doing interlock testing, they're restricting patrons. If they're adding chemicals, if they're doing pump room or other maintenance. However, there is one exception, and that is some of these larger water parks or schools have people who really know their systems and can isolate systems so that whatever they're doing does not affect what's going on in the swimming pool. So if they're trained to do that, they should be able to explain to you how they keep people safe while they're doing their maintenance. But for sure, they should not be doing interlock testing when there's somebody in the pool. The picture on the right shows what we've seen in some hotels or motels that have been built before 2017, and also can happen in some pool areas where maybe there's a lap pool and a smaller exercise pool or something, and a whirlpool, and maybe one pool is closed but the others are open. So we want to make sure that they have a way to close a pool if access to the pool area is not or cannot be restricted. We changed the bromine regulation to align with the Model Aquatic Health Code and also the EPA regulations. So currently the EPA doesn't approve any bromine product to be used above 10 parts per million. So the Model Aquatic Health Code has 3 to 10, so we're aligning with that. It does, we were able to lower the lower limit or the lower minimum for bromine to 3 in some cases. And the other change is that for cyanuric above 300 parts per million, it's now considered toxic. So that is going to be in the closing criteria that we've proposed. We have simplified and aligned the minimum disinfectant residuals to align with the Model Aquatic Health Code and the proposed regulations that are on SharePoint. All of the documents that I'm mentioning on SharePoint, if you just look on the text list for under SharePoint where it says proposed, all 3 are on there. So the table 7614 table A is in there, and I'm not going to go into the details here because it's very detailed, but not much has changed for swimming pools, but we've aligned some of the other items to be a lot more simple so that there's one level of free chlorine for everything except pretty much wading pools and whirlpools. And then we've aligned with the new limits for the new minimum disinfectant residual if cyanuric is involved. Another major change is for combined chlorine. And so many of us know that combined chlorine can be very complicated. It can be, you could be measuring the level in the water and finding nothing wrong, but you could still have complaints of eye and ear or eye and respiratory irritation. So we have come up with a plan, and someone suggested to me to make a template for this. So we are also developing a template to help operators to know what is required for this. So the management plan will be what is required. And so we're no longer going to be going there measuring their combined chlorine and enforcing based on that. The enforcement will be based on whether they have a plan. So the plan is going to take into account how much source water they're putting in, how much fresh water, the volume of their pool, how they're communicating to people about taking a shower, what they're doing when they have complaints, how well they're keeping track of breakpoint chlorination. So the plan is what is required, and the code is going to have a lot of details, and also watch for the template that I mentioned on that will help people to meet this goal. And then there also will be a training module, one of the 5 to 10 minute training modules you can take on this. Certified operators, we will still be requiring them for all water attractions, but also if a pool has 2 re-inspections in 3 years, we will then be requiring them to get a certified operator. So either have one or contract with one. And in general, we've clarified the certified operator duties as there's someone who maintains the chemistry, the water quality and clarity, and the water temperature. And also so that they ensure that the equipment is functioning properly. And finally, they do need to respond within 3 hours. So that is something that we were able to clarify as well. Table 7623B is where we talk about which lifeguards are required, or lifeguards or attendants are required for features and other uses of the pool. So we were able to clear up some of the confusion in the code around that, because as you may recall, instructor or pools within instructional programs are handled in some text currently that's below the table 7623B, so it's easy to not see them. We also haven't yet put current pools with currents and treadmills specifically into the code, and we don't have swim up bars in the code. So swim up bars are something that we've been dealing with through variances. So now we put them into table 7623B along with therapy pools with the current and treadmill. And in that table, we explain what the item is in the pool and then what type of supervision it needs. The other thing that's changed is we now specify shepherd's crooks for non-lifeguarded pools. So they're required at any pool, but they at a non-lifeguarded pool, we want them to be long enough to rescue someone anywhere in the pool. So we've had a couple instances where if the shepherd's crook had been longer, it might have saved someone. So if there's a 9-foot deep pool, a 10-foot pool is not going to reach much of the deep end. So if you do your geometry and the depth is 9 feet and you're trying to reach someone 12 feet from the side, you're going to need a pole that's 15 feet long. So your 10-foot pole, and as you can see in red, isn't going to be of any help. So this isn't the case at lifeguarded pools, because obviously we would need shepherd's crooks that were hundreds of feet long for that, but just for pools that are not lifeguarded. We've done a lot of variances for cell phones and voice over internet phones. So as long as they meet the basic criteria, they will be allowed under the new code if it passes. So there must be a reliable service connection to permanent continuous power, along with battery backup. This is going to need to be within 25 feet of the pool area. And the one question I get is, can my cell phone just on its own be okay? But that, no freestanding cell phone. So no, just taking a cell phone and putting it on a table or in a cabinet or something will be okay. It must meet all those criteria. And 911 only phones are okay. This is what I was alluding to before with the prolonged breath holding. So first, for children under 12, that will be the one thing that we're requiring to be added to the sign, and also requiring the breath holding to be added somehow. Operators can add it to their sign, or they can communicate it to people in another way. So they could post a poster or talk to them about it or have a flyer or something, but they somehow need to communicate the message to patrons that they should not be engaging in prolonged breath holding games, either contests or just preparation for competitive events or things. Like the one incident that we had was actually a lifeguard who was trying to improve his lung capacity, and he was at the bottom of a pool, but no one knew that he was in trouble, because when you do the hyperventilation before you go into the water, your body doesn't know that it needs to breathe. So he didn't know he was in trouble, and no one knew he was in trouble, and he drowned. And just in preparing for breath to be able to have more lung capacity for competitions. This one might not affect everybody, but we have some of our larger water parks where they have new rides that don't really fit our existing water attraction rules. So if that's the case, they can just convey to the riders or patrons how to safely use the ride or attraction, and they can use words, pictures, or symbols. So this should be able to clear up a lot of confusion and a lot of variances that we have, because some of these places where they come up with a new ride, it doesn't fit our sign, so they have to apply for a variance to have a different sign because our language wouldn't make sense. For whirlpools, we've removed the word elderly, and we've just stated persons with heart disease, diabetes, or high or low blood pressure should consult their physician. And this is pretty much the same, although we've covered minors under the age of 6 are not permitted in the whirlpool. We have added some language to help strengthen our response to waterborne outbreaks. So if the operator has complaints of illness, they need to do certain things to facilitate investigation of the outbreak. So they're supposed to work with state and local health and follow CDC guidelines for decontamination. They're supposed to wait, though, to be advised on what to do from the state or local health department or DATCAP, because we have this now where there might be a complaint or an outbreak related to hot tub rash or legionellosis, where the hot tub gets decontaminated and scrubbed before we can do our sampling. So that doesn't help us to understand if the hot tub was involved in the outbreak, as well as if they had just left it alone. So there's some specific guidance about that. And there is a training module for everyone to use for that. This one should come as a relief to a lot of sanitarians and operators. Pool plans will be required under the proposed code for new construction only. So moving forward, there'll be a date set when pools must have pool construction plans. So it'll be a date in the future. So for all pools, they must have a pump curve and a drain cover log and receipts or affidavits from the pool company. The best thing is going to be the drain cover log. So please look on SharePoint and use the drain cover log that's recently been developed, because that will help you and help your operators to track the life of that drain cover in that pool and provide you with the information you need for VGBA at a glance. So it will align with what's proposed in the new code, but it's also perfectly legal now. It meets the requirements of both codes. And there will be a VGBA training module. So I do have VGBA training that I do, but there will be a module as well to familiarize people with VGBA and the new code. Once again, this will be on the right, this is the new drain and equalizer cover log. So it has, the main difference is there's going to be one, or there is one log sheet for each pool. So it lists the name of the pool, where the pool is, the date of the installation, the location, the number installed, the manufacturer name, model number, lifespan, gallons per minute. So those are all things that are essential pieces of information that we need. So as they change out the cover, they can fill that in on here, and the lifespan can be traced for each cover in the pool. On the left is an example of a pump curve and a pump. So that for existing pools, that is what they're going to need, is the pump curve and the pump. And if you haven't taken the VGBA module, just in short, the gallons per minute rating is going to be based on the total dynamic head of the system, which is generally going to be considered about 70 for a sand filter. And then you need to know which curves. So these curves will be, each pump will have its own curve on here. So they've put 4 different curves on here, but you can extrapolate from this. You can go over to the point on the curve where 70 hits if it's a sand filter pool, and go down and find out that they need a drain cover that's rated at 35 gallons per minute. So that's just a very quick, brief way of saying what I've said in my VGBA training. So if you want to know more about that, let me know. I can set that up, or I can help you look at any plans. But for the purpose of this presentation, this is what we're going to want in the new code: the drain cover information and the pump curve. So that will make life a lot easier, unless, however, it's a new construction, a new pool. And then in that case, they will need the pool plans and then also the drain cover information. No more variances for dog swims. We've taken much of the language from the variance and put that directly into the proposed code. And the other changes, like I've said, are outlined in a chart, and it's called proposed changes to ATCP 76. That's on SharePoint, or if you need it, let me know and I can email it to you. And there's also information on the web. So that's going to be on the next slide, and that'll be the economic impact analysis, the plain language analysis, and the whole revised code. The revised code is also on SharePoint, and it'll actually be the next slide where I have these addresses. So just hold that thought for a minute. Key items that did not change. Most chemical parameters did not change. For example, the pH range and things like that, alkalinity. Basic turnover requirements, those have to line up with the SPS. We didn't change those. Certified operators are still required for water attractions. Lifeguard table ATCP 7623A did not change. So the table that says what size of pool and patron load, how many lifeguards are required based on that, did not change. Enclosure heights are the same, 5 feet, or for some of the older pools, 4 feet. Drinking fountains are still required. Swimming pool signage, other than additions covered in this presentation, did not change. And maximum patron loads allowed. So the 10 feet per patron in a whirlpool, for example, that sort of thing did not change. This is the slide that I'll give people a chance to look at if they want to write it down or take a screenshot of the addresses. But if you need any documents I've mentioned, feel free to let me know. I'll send them to you. You can also use a recreational mailbox. The top bullet is the rule revision documents are posted at this address. So if you go to that address, you can see the revised code, the economic impact analysis, and other documents. And the second bullet is the public facing pools page, and the recreational mailbox and then my mailbox are there as well. A reminder on training, we will have short modules for all of the training that are available. And there'll be recordings, so you can just go to wherever they're located. I don't know yet, but you can just click on them and listen and view them. The new marking instructions are done and they're being currently under final review, and they're just waiting for the green light. Those are kind of important because they are going to be referred to by another number of other documents. So we had to get those done first, but they're done. Janice and Amanda and Rock County are taking a look at them, and they're actually out using them. So we appreciate that greatly, because that will help us to understand better how well they work in real life. So what I've done with the marking instructions is I've grouped all of the items that deal with signs under one item. So if you find a problem with a sign, you don't have to hunt for where it is anymore. You can just mark it under the item number for signs and move on. Similar things happen elsewhere. So dog swims is kind of grouped together because we don't have a lot of those. And hopefully things are a little bit more intuitive, and the form is a little bit easier to use. The health space form is. Also, there will be workshops in Eau Claire and Green Bay and virtual to introduce the new code. And that is it.
All right, so at this time, if we have any brave souls that want to come off of mute to ask any questions, please feel free to do so. Otherwise, if you are more comfortable with entering your question in the chat, you can do that as well. I guess to kick things off, I was just going to ask, and maybe your training modules kind of express this as well, but you were talking about at that hotel how there was the whirlpool and the larger basin pool. And when they're doing maintenance, you said that they had to kind of restrict that one pool area. So if they're within
Right.
the same enclosure, do you have any tips on how operators could maybe ensure that the larger pool, I think it's easier for the whirlpool if that one's having maintenance, but
Right.
in a larger body of water, what would be a good technique for operators to use?
The best thing I've seen are, they'll rope off the entry ladder and put a closed sign, and then also one of the, those things they use for mopping the floor. When the floor is wet, there's that sort of yellow sort of triangular thing. One of those to indicate, and then post a closed sign on it. So we don't say exactly how, but those would be ways that they could do it. And then also supervising it. Someone should actually be looking at that pool and making sure no one is going into it.
Sure. Okay, we do have a question of what is the thought process for requiring a drinking fountain?
The foundation for that is, number one, it's required in DSPS, so there would be their thought process, but our thought process and why we take it seriously is because dehydration and hyperthermia can happen very quickly and easily. And if water is not conveniently available, people may or may not drink enough water. So we do get every year a couple of reports of hyperthermia and dehydration. So we want to make sure that we're keeping water available to people with no obstructions to it.
So I recall during COVID times, everyone was turning off the drinking fountains, and it was acceptable at that time for bottled water, free bottled water to be available. Would that be something that if a new facility was going to be putting in or building a new pool, that they could maybe get that as a variance?
You would have to ask DSPS, but I don't think so, because that would be required by DSPS. I don't think we would do it either. We haven't been doing any, if the pool was built, I believe the cutoff year is 1965. So if the pool has been built during a year when a drinking fountain is required, they must have a drinking fountain.
And another question about the different features. Will portable basketball hoops be considered a feature, ones that you can easily move away from the side of the pool and then have it brought out when people want to use that? Is that classified as one of those features?
Let me see. I can tell you the answer in a second here, because we define what features are. So I think we left that in, but I have to look that up. I know we've got diving boards and, okay, so my computer is malfunctioning. It's kind of I'm asking it to do too much, I think. So I can get back to you on that one, but I think we did leave basketball hoops in.
Okay. And if you have not already created some of those training modules, maybe just adding that in as one of those touch points as well.
Sure. I think I have one on features, but I'll check that.
Perfect. All right. We do have a question. Do we know when the new code will be reflected in health space? So keep in mind, this is just a proposed code as of right now.
Yeah.
But yeah, can you speak on that? Of if it does all go through, when will we expect to see those changes?
We have, I believe, about a week left to wait for there to be any further hurdles. And if everything keeps going forward, my belief is that we'll have the new health space by the time we're using the new code. So I don't control health space, so I can't speak for them, but I am ready to go. So Jim and I have finished all of the language, and it is just sitting there waiting for the green light, ready to go to health space. So as soon as that team can get to work on it, which I believe they would probably start possibly at the end of this month, my guess is it would be ready to go by the time we have the new code. But all the pieces are there.
So are you saying for the 2023-2024 licensing year, it would be uploaded into the health space legacy program?
I'm not real familiar with the newer health space program because I don't have it, but whatever we're asking people to use, I believe that's the goal is, if we're going to be out inspecting, we need to have the current code reflected on health space. So my guess is that we wouldn't be asking people to inspect to the new code without supporting it on health space. I can't speak for health space or that team, but my belief is that we will have this ready to go, because all of the pieces are there and it's just sitting there waiting for the green light.
Okay. And Mary, I think I saw you chime in. Do you have a question?
I do. It has to do with the licensing categories. Mary Ellen, I think you mentioned that whirlpools would automatically be 2
Moderate.
points.
Yep.
Okay. But then when you had the table in the slide, the first category of simple was 0 to 2 points. And then the second category of moderate was greater than 2 points.
Oh, I'm sorry. Yeah, a whirlpool is going to be 3 because they'll have a recirculation system, a basin, and then there'll be a whirlpool. So they'll have 3 points.
Okay, great. Thanks.
Sorry about that.
All right. Do we have any other questions? I'm not seeing anything else come up in the chat box, but if anyone wanted to come off of mute and ask, I would love to have you chime in. All right, and I'm not seeing anything unless, yeah, it doesn't look like we're having any more come into our chat box. So thank you, Mary Ellen. We really appreciate it.
Sure.
This was very informative to see what might become the new code, keeping that in mind of nothing has officially gone through quite yet. And just a reminder too, next month we will be having from DHS, it will be our state public health vet is going to be talking about the rabies quarantine. So please join us again next month in April. And again, if you haven't renewed your membership, or if you are not a member, please join so that you will get all of those notifications for the newsletters and the webinars in the future. Thanks, guys. Take care.